Okay. Good evening, everyone. This is the City Council's special work session that it was supposed to be held on the 14th. It's scheduled to be held tonight, and we are gathered for that. And our council meetings and work sessions are hybrid meetings. So all of the council members and city staff is in-house, but the members of the public can attend the meeting in person or via Zoom, webinar/conference call. And you can also watch us on channel 16 or 859. Or you can also go online at www.burnsvillemn.gov/meetings. And we're also on PEG TV Roku channels. And you may speak during the meeting via telephone or Zoom conference service at no cost. All of the information about the meetings are in our packet and on the website /meetings. So if you wish to join us on Zoom, you can go to https://zoom.us.join. And we go directly to our items on the agenda. And the first item on the agenda is the Preventative EMS Pilot Work Plan, and presenting is Fire Chief Gentleman.
Good evening, Madam Mayor, members of the council. We're excited to be in front of you to come back to talk about the EMS prevention pilot, and we're super excited about the opportunity here. And I'm going to turn it over to Assistant Chief Dwyer, who has more expertise on this than me and can speak to the issue. But I do want to point out that Burnsville is doing this differently. From what we're aware of, is we are the only ones in Dakota County doing anything other than funding drug task force with this opioid settlement money. So we're doing things very differently. And across the metro, we're seeing the money used for drug task force, Narcan, or social service programs or social workers. And we've worked very closely with the police department and the behavioral health unit there and Chief Schwartz to find out what this could be. So we feel like we've got a good place to start from, and just to point out that this is a pilot and we know we're going to learn as we go. So we're super excited to get this underway and see what we can bring to the community together. So I'll turn it over to Assistant Chief Dwyer to talk through kind of some topics around a high-level work plan around this.
All right, thank you, Chief. Madam Mayor, members of the council, thank you very much for having us again, and I'll echo what the Chief said, and is that we're excited about this, so we appreciate the chance to see what we can do with it. So maybe, there we go. Starting out, just taking a look, we want to kind of go out and see what we can do with proactive visits. That might mean identifying frequent users of the system, not necessarily people, but it might be maybe group homes or facilities or things like that, just kind of identifying areas of people or group or facilities like that would be maybe of benefit from us being out there. Doing some in-person visits with them, I think from our perspective, we could be helping to manage meds or maybe understand discharge instructions, things like that. So there's a lot that we just kind of want to explore with that. The other part of that is going to be doing some follow-up via the phone or in person, depending on kind of the staff's time and the availability of the people that we end up wanting to interact with or needing our interactions. The next part of this is going to be education, and much like the visits, we want to take a proactive approach to this rather than reactive. So we're going to be taking a look at trying to identify what kind of topics are we referring to. Right now, this could be opioid abuse in the sense of overdoses or medication management, again, as I mentioned with the visits, but trying to identify those topics, identify those target audiences, whether it be youth groups, school groups, churches, even businesses. We've had people reach out even from businesses perspectives that have people that have issues within their business that just don't know who to reach out to, and this could be a great chance for us to do that. Along with that, we can help kind of create literature and presentations. And the good thing is that there's actually stuff out there that already exists, so we don't have to reinvent the wheel to go create all this new literature on what's out there. In fact, Dakota County would be a great resource for a lot of that, as it exists through them already. Well, how are we going to make this happen? The best we can say with our operation is it's going to be about 8 hours per week. This is give or take. We're going to be using folks that are off duty with this coming in to help us with this, that are interested in getting out and working specifically with this topic. We're going to need technology. Technology is everything these days, so we're going to need to establish getting a phone and computers, things like that. We have existing vehicles that we can use to make those in-person visits and make that happen. Looking at community health record system, we need a different module than what we're using right now for our EMS system, and there's a community health record system out there that we're going to need to use to help us track patients, and it'll honestly help the people that are doing the work stay in touch with what's going on anytime that they're out there working with those folks. A big question is going to be measuring results. For us, it's going to be very transactional. It's going to happen kind of in the moment. It might be number of contacts, or it might be success stories, or it might be stories that maybe didn't go as planned, and we're going to be learning as we go here. So taking the good with the bad and just learning as we go with it and see where it kind of takes us.
Madam Mayor,
Yes.
question. Given HIPAA, what is contained in a community health record system that's not private? I guess put it that way.
Well, there's still going to be things that we're bound by HIPAA with. A lot of that's still going to be there. As far as if we're working interactively with someone from maybe the police behavioral health unit or the crisis system, we might have to have an agreement of release of information, if you will, within the people that are playing it. It might be the patient themselves. It might be the caretaker. There's information that we can share, but still HIPAA is going to be a big part of this for us. And it's just a different system of tracking, more specific to what they need, not so much for our emergency run forms in which we have all the data that's in there that needs to go to the hospital. So it's just a different setup for us as well. But HIPAA is still going to be a big part of that, and we'll have to kind of work around that legally with the release of information documents and things like that.
Do you ask for the release when you interact with the person? So is there any information that you can have that's public before you gain authorization from the person that you're interacting with to get more?
I mean, I'd say there's probably not going to be a lot of public information with any of our interactions, to be honest. It's going to be tough enough just to make sure that we're, and maybe tough's not the right word, but it's going to be enough of us to, of a challenge, if you will, to just make sure we're sharing the right information with the right people at the right time. So what we can share from this is going to be things that aren't going to be identifiable. It's not going to be patient name and address, things like that. It's going to be strictly in the count of numbers with that. So within our organization, we can control the conversation, and we can talk about patients within this group. And then again, with that release of information, it's going to probably be pretty restrictive between the patient, the caretaker, the guardian, the police department, behavioral health unit, if they're involved, or Dakota County Crisis, whomever the patient or the guardian agrees to kind of say that we can share this information with them.
So this community health record system is a system, but it's not accessible from a data standpoint until the person provides authorization, and then you can get into it and pull their health records, their medication, whatever it might be that can help you help them better, right?
Madam Mayor, members of the council, I think it's a little deceiving calling it a community health records. It's a module within our current records management system that we don't currently have. So when it says community, it's not available to the public. It's just a different module to document the encounter with this patient, so it's not available to anybody unless the patient wants to release information. So as Assistant Chief Dwyer said, if in the course of this they're willing to release information to the PD's behavioral health unit, Dakota County Social Services, whoever their doctor is, the caretaker, they would have to actively sign a release for us to share that information. So it's automatically protected under HIPAA because we are healthcare providers. This is just what the module is called, as a community health record system. It's not really a community system from the sense that it's public information. It's all protected unless the patient wants it to not be, right? And we'd have that discussion of, you're in this network and this may be helpful. So we'd have to have that discussion in a signed release, not even a verbal release. We need something on a signature. So
Thank you.
Yeah, they do paramedic work all the time, so they're dealing with all of that information on an ongoing basis.
Yeah, and I would say that the fact that it is paramedics that were out there on the street practicing this on a daily basis, they're very familiar with the HIPAA rules, and so I'm very confident that we'll stay within bounds on this as well. So it's a good thing, because we do understand it at a pretty high level. So,
Well, health records are, these days, you can sign releases and have records transferred from prior doctors or other doctors all into one central, like iHealth system, where then your doctor can see it all, but all of that, of course, has to be pre-authorized, but it ultimately makes it easier for you to help the person that you're trying to help, right? If you know the full story of their health.
Absolutely, it'd make it much easier if everything was on one system.
Yeah.
Yeah.
Someday.
Okay.
Thank you.
Yeah, Kara?
While it would make it easier for everything to be on one system, we've seen way too many encounters where people's health records have been weaponized against them. And so that is a area of caution. And I know when people are dealing with chronic pain management, even the most innocuous mark in their health records that are then shared between agencies can cause them to be completely cut off of all pain medications. So that is a caution that I would throw out there. And I'm sure you will be delicate with that, but just keep it front of mind on that. As for the education, if you could go back to that piece of it, please. Could you expand on that a little more?
Sure. So if you're talking about topics, it's trying to get out and find out what are the needs out there. Is it talking to school age kids in reference to drug abuse, opioid abuse, if you will. If it could be talking to school age kids about, the improper use of prescription medication. It could be, again, like I said, reaching out if a business reaches out and says that they feel they have someone struggling. It could be us reaching out and just simply giving literature information to them to help them, direct them, to help them navigate what resources are out there to get help, whether it be, be it rehab or just factual information about what they might be taking or using. And I mean, I think just that audience side of it, it's all about being, for us, we want to try to be proactive, right? And being upfront with this. If we're looking at roughly 8 hours a week, I can't say that it's going to be anything, at least to start with, grandiose in the sense of we're going to be out hitting this topic every single week for X amount of hours. It's trying to figure out where the need might be, working with our folks in the schools, hopefully getting information, whether it be school resource officers, the behavioral health unit that might be out already doing things. Again, trying not to reinvent the wheel, reaching out to other agencies that might maybe be looking at this model, talking to Dakota County Health. I know they have a lot of information that they've handed out in reference to the opioid trouble that we've had in this country and locally, whether it be the overdoses or just the improper use of medication, disposing of medication properly, any of those types of things. So I think it's kind of broad in the sense of where we're at right now, but we want to kind of dial in and get kind of maybe some referrals from people, and just make ourselves known that we're out there and that this service exists, and word of mouth, and whether it might be, using social media channels at the city to say that this is going to be happening, public forums. Those are just things that kind of come to mind at the top of my head right now, knowing that we're still putting all this together and establishing that team that's going to work to figure out the when, where, how, and why, and the who's. So.
Okay. You've said several things that alarm me. Generally speaking, City Council gives strategic direction and then we allow you to do it tactically. And I'm telling you right now that what I'm hearing, no, all bets are off on that. I'm going to be very involved in this. I am extremely alarmed that I'm already hearing again this focus on prescription medication. And that's not where our overdoses are coming from, and that's not where our addiction issues are coming from. So the fact that we're already in this education starting to focus on that, I am not down with that at all. So I will be extremely interested to review every single thing. So I will not be staying in my lane.
So one of the things that I know that you're very good at, because we work with targeted populations. For instance, our senior community. I know that the work that you've done with our veterans, because of all of the mental health issues around our veterans. And when we meet as the Yellow Ribbon, there's always someone from fire involved in all of that work, and from police. So I understand that we do have targeted populations that have issues. And what I like is that we're being proactive. And you're not targeting just pain meds. You're targeting how do we keep our community healthy. And, I've seen you work. I've seen the work that you all have done. And the work that you're doing right now in partnership with the Behavioral Health Unit, I think that is something that nobody else is doing. And I applaud you for that. Because right now, in all of the things that I've seen, fire and police do together, whether it's getting into an incident and there is harm done, someone's been shot. Usually in the past, fire always waits till the scene is clear. But boy, I've seen you all go in right next to each other, and you're dealing with the victim or the patient, and police is dealing with getting the scene stabilized and going after the bad guys. So I applaud you for what you're doing, and I understand that you're going to be looking at your target populations, and then if you're going to the schools, to the churches, to the senior community, which is the target population that you usually receive a lot of calls from, and being proactive with all of that. Because I look at your numbers and the number of calls that you have out. What is it? In 2022, 23 already you have 9,000 calls? Or is that 22 data that I was looking at? Okay,
That was 2022.
yeah, 22 data, so 9,000 calls. I remember when you were only having like 1,000 calls a year. Now you're dealing with 9,000 calls. So I think the proactive and the target audience, and I trust the work that you all do. So I'm not going to be in your lane. Yes.
Just bouncing off of Councilmember Schultz's points, one thing that I think we're all aware of is that the fentanyl, the fake pills that are coming over the border from Mexico, seem to be the thing that's killing people most frequently. People get their hands on these things, they think they're, pharmacy grade medicines, they end up being fake, packed with this incredibly toxic fentanyl. I'm wondering if there's room in this program to address that in some way with either, test kits that people could take. I don't want to go so far as to do a clean needle program, but if there's room to look at that, just being as that is kind of where we're at today. It's not so much the stuff that's coming from CVS, but over the border. I think it would be worth at least considering incorporating some of that into this.
Chief?
Yeah, Council, Madam Mayor and Council, we hadn't programmed that in as part of this, as part of the costs of that. It's something we can evaluate, and I know Assistant Chief Dwyer was relating to prescriptions, and I don't think it was intended to be specific to prescription, but pills in general. People are just taking things, and they don't know what they are. So the education is, what are you ingesting and why are you ingesting it, right? Like, you may not know what it is, and people may package it like it is a prescription, and people don't necessarily know what they're taking. And so the education really is, don't take things you shouldn't, and the things you do, make sure you know what they are and that they are what you're supposed to take, and they're for you, not for somebody else. So I think that's the generic area that we are trying to, but I would say even bigger is this program is really a community risk reduction program. If I equate it to on the fire side, it's what we do with apartment buildings, right?
Yeah.
We identify that as our biggest life hazard on the fire side, is the non-sprinklered apartment buildings, right? And we've had many conversations about that, and that's our target population. And by setting up this program, we're gonna do some more in-depth analysis of the population that we haven't done and haven't had the resources to do, so that we can focus our effort. We have a constrained amount of resources. How do we make the biggest impact, right? So let's look at where are we seeing the overdoses, why are we seeing them, right? And start to uncover that, find out those target populations, and start asking some questions so that we can start addressing that. So I think this was kind of meant to be more generic and saying, we're going to provide some education once we identify who those populations are and what their needs are, and we don't necessarily have to create all that because a lot of that material already exists. How can we redirect it and use it and benefit the community? Hopefully
Yeah.
that makes some sense.
Vince?
Can I just follow up on that, PJ? So if, you know, measuring results is part of this, how labor intensive would it be to track, you know, if you're on an overdose call, is there a way to measure what was overdosed or what drug was used? I mean, could you track, oh, this was a heroin overdose, this was an over-the-counter opioid, or was this a illicit fentanyl? Is there a way to start accumulating that data? Then it might guide, you know, obviously we have to be vague to start this because it's a pilot program, but is that something that would be too cumbersome as this goes? You know?
Yeah, I think it's hard because we don't have analytics to
Tough,
figure
yeah.
out this, and a lot of the stuff isn't packaged, right?
Yeah.
So, and people aren't always willing to talk to us when we get there, right? So, one measure we have is whether Narcan works or not, right? Now, Narcan generally dictates whether it's an opioid or not, but I would tell you some of the stronger ones might not
Yeah.
react well to the amount of Narcan we're giving, because you're seeing people take some tranquilizers that are much stronger, right? So, yes, we do have some of that, but the only true way for us to know that would be to see their labs, and
Yeah.
back to the HIPAA issue,
Yeah.
we don't get that kind of feedback. So it's tough for us,
Your
because once we drop them off at
toxicology
the
report.
hospital, that's the end of our ability to really get in-depth care knowledge. But I think we do see enough trends in our data to be able to say whether it's opioids or not, or whether it's something else, right? I do think we do see those trends that can help us. And I do think after 6 months of this running, we're gonna have a lot better information, because we're gonna have people in the trenches visiting these people, right? Right now, it's data without any story around it, right? And there's so much context. And if we can talk to these people when they're not overdosed, when they're maybe a high-risk population, I think we can find out a lot more, and we can be more targeted and probably end up in a much better place and use our resources wisely. And then things like you said, some of the tactical things, whether we're doing test kits or doing some of those things, I think those are things we can figure out once we understand the right population and the right reasons for what's happening. I just don't think we know enough. We know it's a problem. We have an idea, but we don't have the context. And I just don't want us to shoot everything out and then it's not working, right? I'd rather us be more pointed and say, what's gonna help? And I think the folks on the ground talking to these people will give us a good sense of where we need to go.
But I think to Kara's point is the difficult part is gonna be to gain that trust, right? To have that person openly discuss what they were using, why they were using it, without fear of repercussions, you know, for talking about those things,
Sure.
right? And that's something I'm sure hasn't been lost on you during this building of this program, but, you know, drug use is a pretty personal thing for a lot of people, and so to crack that shell and get through and actually have somebody open up and talk about it would be wildly successful.
And Madam Mayor, members of
Yeah.
council, I know it's a bit of a morbid topic, but I think on the ones that we can't save people on, we also have the ability to go to the ME, and that gives us some results, because those we can get tox screens on and find out, right? So the most lethal ones, we can help unwind that a little bit too. So, again, I think there's a lot of avenues. We're just so early in this that we don't know what we don't know.
Yeah.
And we're coming
Chief.
up with the best information we have, and I know it's pretty broad at this point, but again, it's really that risk reduction model. How do we find the right target audience and do something that makes a difference?
Chief, when we encounter deaths by overdose, because we have had incidents of death by overdose, do we ever see the toxicology reports or not?
Madam Mayor, sometimes.
Yeah, and I was just going to say that
There's not a
sometime-
great answer for that.
Yeah.
We can request them. I think we've built a good relationship with the medical examiner's office, and I think we can get that a little more regular moving forward.
Yeah, if you, we're going
but-
to try and understand what are the drugs of choice and so forth, that'll help if we get a toxicology, because I know that we've had incidents. So if we've never gotten it in the past because we weren't looking to measure that, this might be something that we can add into the ingredients of things that we might need. Yeah, Dan
I was
G.
going to ask, excuse me, do you envision going forward at some point, you'll be working with like recovery housing and some of the treatment centers? So as you're identifying people and working with them, that we have a referral that we can help get them into different situations where if recovery is needed, they have to have a chance at doing that? And again, I get what he just said, it's a pilot program, and you can't envision everything right away, but I'm just happy that we're trying to do something with a community outreach with this program and reach out to people. And we're not gonna get to everybody. We know lots of people in recovery that never make it, but we also know a lot that if they're given a chance, they do make it, and their families heal, and, things get right for them. So I think what we're doing in Burnsville is really a good thing, instead of just throwing out a drug force and say, here's your money, go do what you're gonna do. We're taking more of I personally think it's more of a human approach to it, where we're not making them the enemy, we're trying to help out. We're trying to help you, and I think that's important for us to be that way.
Yeah, Madam Mayor, council members, I see us as a navigator, right? I mean, if we can collect resources and provide them to people, what works for one person might not work for the next.
Yeah,
And
yeah.
if we can give them some opportunities and
Yeah.
places to seek help and, follow up with them to see if they do get assistance, I think that's a good role for us, right?
Mm-hmm.
Is we may not be able to provide the end care that they need, but we can help them get to the right place.
Thank you.
Okay. I think, here's the cost.
Yeah, and really what it comes down to for costs is that we're really looking at a roughly about $38,000 annually, and then about a $6,000 startup to get some of that technology up and running. And then the $38,000 would be continuing that technology and the personnel and for their time coming in.
And so really what we're looking for tonight is some council direction. Is the council supportive of the work plan? If they are, the next step would be to bring a resolution to expend funds, which is required in the settlement, and we'd bring that to the March 21st council meeting under consent if the council is agreeable, so.
Okay, yeah. Dan?
Thumbs up.
Dan K? Yeah, yeah. I think we're doing something that is different, but really addressing the human factor and caring about, because there's a lot of need. You see it, I see it. I mean, today I got another letter from a veteran, and we couldn't read it. I couldn't read it. Michelle couldn't read it. We tried to get everybody else. There's mental health issues. I have another gentleman who does that, and we've gone out to meet with them from the Yellow Ribbon campaign. And he writes me every week, sometimes 3 times a week. So there are issues in our community, and we need to be cognizant of that. So I really am happy about the work that you all are doing, because there's a lot of need. So thank you for doing it proactively. So then a resolution will come before us
Yes,
to expend the funds.
Madam Mayor, we'll bring the resolution on the 21st.
Okay, very good. Thank you so much
Yeah.
Thanks
for
for
all
the
of your work,
opportunity and
Neil.
support.
Yes, thank you.
Yeah. Okay, the next item is the second round of opioid settlement funds. And Jenny, you're up, our CFO.
Good evening, Madam Mayor, council members. Tonight we'll be talking about the next round of settlements and what that means, and just have an update on what we know to date.
Okay.
So new A new round of opioid settlements reached has really brought an additional round of funding. We've been notified that there is an additional round of funding.
Okay.
I-
Michelle is still working
Sure, we're
on her
working on the-
slides. Or are you controlling the slides from there? No, Jay is coming.
Oh, and
Tom should be at all meetings.
Can you move it?
Reboot.
Try unplugging it and plugging it back in.
You know, it performs billions of instructions a second. It can get stuck once in a while.
It was a British television.
Yeah, exactly.
yay, here we go.
Yeah, I can't do three things at once. and I
Can you
start-
move your,
Did you turn it on? Oh, okay, good.
okay, there
There
you
we
go, yay!
Yay.
Thanks, Jay.
So the Attorney General is amending the existing MOA for this new round of funds. So we have not received that information, those updated agreements yet, including the funding allocation, so we don't know the exact amount that Burnsville would be allocated, although we do expect that the allocation percentages are going to be the same or mirror that original memorandum of agreement. We also believe that the terms of the agreement and the allowable spending is going to mirror that. I believe their amendments really just surround these new settlements. We've been notified of an April 18th deadline to submit to be part of this. And one thing we do expect in the updated MOA is a mechanism to auto-enroll in future settlements. I think the Attorney General's office, or generally speaking, they expect additional settlements to follow. One thing that our plan, in terms of communication and commitment, in terms of council discussion, we want to make sure council determines the outcomes. So in terms of the new settlements, if we have a choice in that, we will always come to you at check-ins, discuss at work session, and then follow up with approval at a council meeting. So that's what we know as of right now. We do expect those updated Attorney General MOA agreements to come any day. We do have a tight timeline. In terms of next steps, I think first we wanted council direction on whether council's interested in participating in this next round of settlements. These are in addition to the two that we already are receiving, so it would really result in additional funding restricted for the opioid remediation activities. And I think that if council decides they want to participate in this next round of settlements, the next step from there is a resolution that needs to be approved by council at a council meeting.
Well, the case has been settled and money is being distributed, and I think we should take ours. Yes, Kara?
So the question is, will we be asked to sign on to something that we do not know what we're signing on because we don't have the MOA yet? So I don't know if we should sign on to it or not.
Right, and we as of today, we did not have it.
Right.
We expect the terms to be the same. Certainly we can come back and communicate as soon as we do receive anything. Part of why we wanted to come tonight is the compressed timeline, and so we're under a little bit of a time crunch in terms of making sure
Okay.
we're getting that communication out.
So
Yeah,
do you
and I
know,
appreciate-
there's just an amendment that they're doing to the original MOA, is what the background says.
Yes.
So
Yep.
it's the MOA is the same, but you have an amendment that we don't know about.
They are amending the existing agreement. We don't expect changes to terms, so I can't tell you with 100% accuracy there are none without having it in our hands.
Madam
but-
Mayor, members of the council,
Yeah.
I think to Councilmember Schultz's point, staff is very interested in seeing something from the AG's office and doing that assessment so we can give you better information. What I don't want to do, all indications from the state AG is that the April 18th deadline will hold. I wanted to come to the council with some form of discussion today, just because we don't have a whole heck of a lot of public meetings between now and April
No.
18th. And staff would share the concern that we want to make sure that it's consistent so the council can give good direction, right? We just don't have those answers right now.
So,
Appreciate that. I just have it's difficult to sign on to something that
Yep.
you don't know what you're signing on to, especially when they're saying that there's going to be an auto enroll for anything in the future, which then takes away local control of this body being able to decide individual ones. So does that mean that they can just make adjustments in the future to any of them on any of the agreements? And since we are therefore auto enrolled, we are automatically agreeing to those MOAs that can just change. I don't have that information, so I don't know.
so let's do this. Staff, why don't you get information from the AG's office and what that amendment is going to be and how it will affect the auto enroll? And bring it back, and then we can move forward with getting a resolution so that we can meet the April 18th deadline.
We have to pass the bills to see what's inside the bill.
I know, that's what I feel like.
Yeah, well,
Mayor, council, certainly our commitment to you is to get it to you as soon as we have it. I can't, we're doing our darndest to get the information. And the fact of the matter is, we have very little control over that. So,
Absolutely.
yeah,
We know it's not on your end.
Yep.
Yeah.
So, Mayor, I hear your intention. My concern on this is, I know the council's gonna wanna talk about this, and you should. Frankly, I have questions about an auto enroll option and changes to the MOA.
Right.
So I want the council to be able to vet that. What I don't want to have happen, I'm just gonna be candid, is what happened the last time from a staff perspective, where this just kind of showed up in front of you and we haven't talked about it. So my intention tonight was to at least have the initial conversation that, hey, here's what we know. We're waiting for more information. We know we're gonna have a tight timeline, because I don't want to, and we won't surprise you at the dais with some sort of question on action.
okay.
The reality that I'm getting put in is it could very well be April 11th and you're at the dais and it's the first time that we've had a public conversation about it. I don't like that. That is not my preference. But I did want the council to be alerted to that reality, and I will do my darndest between now and then. Hopefully, we have another work session on the 21st. Hopefully I have something by then. We can add it if we need to, because, why not add this to a budget conversation? That sounds like fun, right? So we'll do our best to make sure those conversations are happening. This is highly dependent on when we see it.
Okay, so we have a plan. You're going to be in contact with the AG's office. Hopefully, we have the information that we need to make a decision by the budget meeting on the 21st.
Yeah, and I think the reality is the worst case scenario is we're talking about this in April, and we'll navigate the best we can if that's our reality.
And
Yeah.
we do expect it every day. Full disclosure, we expected it every day for the last few
couple
weeks.
of
So, I do think it's very close to being finalized.
Yeah.
And other than that auto enroll, I don't expect to see any other change in terms, but we wanted to make sure that we talked about that, so.
I
Okay.
do appreciate that, and I thank you very much for that, and I absolutely know this is not on staff's end, and you all are trying to get that information for us. I'm a little cautious with the AG's office, because when we had that meeting, we did have the assistant AG here promising us that we could just make amendments to the MOA. And that was not correct information. And in fact, when the AG office was contacted, our Attorney General said, absolutely not, we can't amend this after it's done, and he had no authority to offer that to our council. So I would like to see it. Yeah.
Okay.
Yep.
All right, we have a plan moving forward.
Yep.
Are you okay with that?
We have our direction. I appreciate the conversation. Again, I just wanted to make sure the council was talking about this.
Yeah.
And I do apologize that we don't have more for you.
Okay, well,
I think Dan had a question.
Dan, G?
Well, my question was, if we opted in and we saw something egregious show up before 18th, can you opt out? So that we're not screwing around with the
Councilmember
deadline.
Gustafson, that's a great question, and we don't have an answer to that. There are unknowns around
Yeah.
the information that has been shared around this auto enroll option, and we need to
Don't wanna
see
miss
it.
the deadline is what I'm thinking.
Yeah,
It's like-
we need to see it and allow the city attorney to review it and answer those questions, and as soon as we see it, we will start that work.
Part of me wonders if we're responsible for that auto enroll.
Oh,
I think you
I,
are.
I'm suspecting we are. Because we were about the only ones that just didn't throw it on
It's the
consent
Burnsville
and call it
auto
good.
enroll.
Boldly leading.
Yeah, that's right.
okay.
Transparency.
All right. Staff has directions to move forward, and we'll get information, and then we'll give direction after the information is received.
We'll be back to you as soon as we can.
Okay, thank you.
Thank you.
The next item is an overview of the scheduling of outdoor youth athletic fields policy, and presenting is our Parks and Recreation and Facilities Director, Garrett Beck. Garrett?
Someone could have done that for you, Garrett.
Garrett, if you could go ahead and make the presentation too.
All right. Good evening, Madam Mayor, members of the council. Tonight, we'll be taking a look at our field policy. You may recall back in September of 2022, there was a request that staff bring this policy forward to council just to talk about how we allocate fields. Over the last 5 months, staff has had a chance to kind of dig into the policy. The last time we updated it was 2018. And I thought it was appropriate, rather than just to bring the policy forward as is, that if we noticed anything that would be beneficial to clean up and improve it, that we would bring those suggestions forward as well. So tonight, what you're going to be hearing is a little bit about how the policy is administered, but also in our review, we wanted to make sure that what's in the policy matches what our current operating procedures are. We wanted to make sure that if someone was reading the policy, that it was clear and concise, and it didn't lead to additional questions and whatnot that we couldn't cover in the policy. And then with all of our policies and programs and things that we do, we always want to take a look at how is this equitable and accessible for our users in the community and whatnot. So the first step on the policy, are the procedures clear, and do they reflect what we're currently doing? And so the answer to that is we did find a couple things that we would recommend be added to the policy in the future. The first is the current policy, as you see on the screen there, the recommendation is first priority would be city events. Not suggesting that if we had a user group, they used a certain weekend at a certain park every year for the last however many years, that the city would just come up with a program and go in and remove them. But instead, if we decide that there's an open weekend in a space that we want to put on an event, that the city would go ahead and book that out. So if one of our second priority groups or third priority groups wanted to come in and we had already reserved it and it was something that we were using, that we, we'd be able to say, hey, as our policy says, on open dates, that we would like to do something that is reflective of how we do it. So the other piece in there that we have been doing for years and years and years, whether it's if we need to hold out a facility or if the weather in the spring does not allow groups to get out onto the fields, we do reserve the right to restrict or refuse the use of that. So it just seems like good practice to, get that included in there since, and we have a good relationship with all of our users. We've been doing this for years. So again, it would not be a surprise or a change to how we've been doing business. The concise language piece, as we were going through it, one of the things that, I'll just jump back real quick, is second priority is Burnsville Area Youth Athletic Associations. So one may ask, what is a Burnsville Area Youth Athletic Association, right? So if you just read the policy itself, you don't really have any other additional information. In reality, we do actually have a different policy that explains clearly what a youth athletic association is and what the 6 or so criteria are to qualify for that and whatnot. We thought it may be appropriate to recognize the fact that our youth athletic associations that we've been working with for 30-plus years have been great community partners for us and put a lot of sweat equity and financial resources into helping us to make improvements in the park and do certain things to enhance their experiences there. And then the other thing, the fees in the current policy are kind of splattered amongst the different priority groups. And so the recommendation is that we just have a fee section, so if someone wanted to quickly see what the different fee structures are, that they could jump to that part of the policy and be able to understand and see what that is. And then the last piece is from an equity standpoint. Not really any recommendations on changes here. This is more just an explanation of the fact that once we go through the process and take care of city requests and our first priority groups, as we move on to other groups that have put in their requests and whatnot, our staff do a great job of trying to work with whoever has spaces to try to figure out how we can get as many people out there safely, appropriately into our park system using our facilities. An example of this would be if a certain user group has a field Sunday through Saturday, they may have 5 uses out there during that time period. And let's say a person that lives by a specific field wants to do a birthday party. They'll call us up and say, hey, can we use this particular park on this day? And our staff response is basically going to be, let us check into that to make sure it's available. And if it is, we will go ahead and reserve that for them. If there is a use going on with a first or second priority group, for example, then we would look to say, hey, I'm sorry that's not available at that location, but here are 2 or 3 other options close by with similar amenities that may be able to satisfy what it is that you're trying to do. So the answer very rarely is just no. In fact, most of the time it's, hey, yes, we do have some type of option. That said, there have been times in the past when we're holding out fields or certain times of the year or certain sports where it may be necessary to say, I'm sorry, for this particular time, we can't accommodate that. So as far as our facilities and costs are concerned, the first and second priority user groups and other nonprofit groups that can meet the criteria get our fields for free. And then we do have a fee that's approved by council each year for groups that fall outside of that. So with that, I will stand for any questions that you may have.
Dan Kay?
Sorry to repeat the questions in our one-on-one. Or our catch-up group. I don't know that I was fully aware of the cost sharing or lack of cost sharing when it comes to field usage, but currently, as you're noting, we offer our facilities for free to all the users that want to use a soccer field or a ball diamond or whatever it is. Is that for everybody or just for legacy groups or I don't know what you call them. I don't know if I use the right word, legacy group or legacy users.
Councilmember Keeley, members of the council, the fees are, the fields are free to use for city events and for our second and third priority group. So those are nonprofit volunteer organizations that meet the criteria as outlined in our athletic association policy. Everyone else who doesn't meet that criteria would have a fee that is established by council. For example, someone wants to do the birthday party at a field, or you got a team that wants to run a practice that's not a part of the association or whatever, there would be an hourly rate that they would need to pay.
You
How
have to
many-
cover staff cost.
How many, from your experience, how many cities have that free model versus those that charge all users some sort of field use fee or facility use fee?
Councilmember Keeley, the last update that we did on that question was in 2018. And of the 14 communities that were surveyed, of which many of them were either Dakota County and/or our market cities, I believe 8 were communities that had some type of fee associated for their what they would consider their second priority, like ours. And then the other 6 were we were one of the 6. So there were 5 other communities that did not charge a fee.
It was 14 sampled. I mean, it's a small sample, but 8 require a fee. 6 were like us. I don't know if this is more about the fair and equitable or the fact that we have 2 different classes of users, but all things considered, especially with the amount of budget pressures that we have, I would advocate that we go to what the other 8 cities do and set up some sort of field use fee. Could you share what you know, Garrett, about what those fees typically actually are per user for softball team, soccer team, whatever it might be, per player, per team, per league, whatever it might be?
Yes, Councilmember Keeley, a typical, most of the 8 that do it would follow some type of a model where they would either have a per player arrangement with the organization for a season or a per team number. So it varies between the communities. It could be, I recall seeing something as low as $3 per participant in 2018, up to one that was, I believe, $13 per participant. And then it fell in between there. There was one community that had a team fee of approximately $30, if I remember correctly. So 10 players per team, 12 players per team. It's back down in that $3-4 range.
So it's a pretty small fee. I don't believe we would have any estimate of the revenue that might generate, but I do think putting in a fee across the board so everyone pays is something that's that I would like to see. I do want to point out that I went on the Burnsville BA Sports webpage to find out what registrations fees were for like baseball, softball, slow pitch, soccer, whatever it might be. And they range anywhere from $50 to $150, depending on the age group and that kind of stuff. But I'm putting in context the impact of if there was a $5 additional player fee, how much real financial impact would that have on the players? Because fees for youth sports aren't just the registration for the team, right? It's equipment, training camps, transportation. There's a lot of things, and so it is a cost that families bear today. And I remember bearing that cost when my kids were in soccer and basketball. But I did notice, just to put that $5 idea in your head, the context of what the league fees are. Even with league fees that are only $50, they provide about a 2-month window for people to register. But the final 2 weeks, they actually consider that late in the registration cycle. So it's not a 6-week registration, but then there's this 2-week late period. It's like there's 2 months to register. But if you come in the final 14 days, there's a $20 late fee assessed. which is 40% of the $50. I mean, that's a significant motivator, which is what it's for, right? Motivator to get parents to commit early, right? They don't want a flood of them coming in 2 days before the deadline. So they motivate them by putting in a pretty stiff late fee. So if this discussion turned into any kind of fee of something in the neighborhood of $3, $4, or $5 per player, it would not be a significant factor on the cost of registration. Their late fee is the significant factor if you don't get in early. And that's just one example. But so I'm part of the reason that we're having this discussion is we had another soccer club organization user looking to use our fields. They happen to use the school fields at ISD 191 schools fields a lot because the school engages them to do a lot of soccer programs. But they also want to do soccer on practices, tournaments, whatever it might be, on our city fields. And they are not a legacy user, and they were running into problems finding field access time. And so it was, you know, everybody wants the fields all at the same time, so somebody has to have a priority, right? So if anything comes out of this, I would like to see that everyone has to pay some fee to access and use these fields. I don't believe, you know, for a parent and a child to grab a ball mitt and a bat and walk onto one of our ball fields that's not being used. I think that's what we pay our property taxes for, is to go use those park facilities. It could be the playground equipment, it could be the tennis court, it could be the baseball diamond, it could be the basketball court, where they're open and available and you just go use them recreationally. I think that's where I see our property taxes go, to sort of provide those facilities so we can go use them when they're not being used by an organized club. But any organized club that wants to reserve and secure and use those, I think there ought to be some fee for doing that. So that's my pitch to the council, or my request.
Yeah. I agree with the fees. We've had fee discussions on all of these, whether it's the golf course and the ball fields, that there should be a fee because it costs us to run those facilities. And but we have a policy in place, and if it has to do with our programs, they're free. But otherwise, everybody else pays. And I remember when my kids were all part of the BAC clubs. You know, you do come in and you pay early because you don't want to pay the penalty.
Right.
But the other thing I also like about the BACs and all of that is that they do have scholarships for those students who don't have the financial ability to do that. So I do know that they do offer scholarships. And I like that about that when my kids were. And sometimes, you know, the parents get involved with all of that so that we can help those families. So, yeah.
A couple of things. I don't think we should make this decision without having BAC and our associations either at the table or at least getting their feedback on this before we consider implementing a fee. Youth sports are already struggling to get kids involved, and I could see this being another potential roadblock. I understand they have ways to help with people that can't necessarily afford this, but anytime we do something like this, we always get the public involved.
Yeah.
And I don't think this would be any different. The second part is, I think one of the reasons why BAC and some of these other associations have been privy to being second priority is because they've invested multiple hundreds of thousands of dollars back into our facilities. Garrett, I don't remember what the exact amount was, but am I off course there in saying hundreds of thousands?
Councilmember Workman, no, you're over many years,
Yeah.
you take Sue Fisher Field,
Yeah.
where we have our youth bat and ball sports, and that concession building was about $200,000 that we fronted the cost upfront, and then
They
they
paid
paid
us
us
back.
back over a period of 10 years. So just that complex alone had a $200,000 contribution to it from the organization. But
So it's not just purely a good old boys thing where they've been here the longest, so they've, earned this. It's, they've been a willing participant in the upkeep and ongoing maintenance of our fields. So I think that's something to consider as a part of this. Now, I'm not saying that any new group that comes in is obligated to spend hundreds of thousands of dollars on our facilities, but I think we at least owe BAC and the other associations a voice if we're going to go this direction. I'm initially not, I would rather see us just strip fees than add fees in this situation.
Vince, I agree with you. The Burnsville way has always been that we bring people to the table to help us solve the problems. We've always had people participate in all of those, especially if you remember the ICE incident. We had all of our user groups, and they came to the table and they gave ICE time away, their ICE time. But it was together we solved that problem. So, yeah.
And if you look at our,
alert them and say, let's talk about the fees, I think they would gladly come and would feel that their voices are being heard. They have been great partners for many, many years in this community. Not just the BAC, but the Hockey Association, the Skate Club, all of those folks who use our facilities.
well, if you look at our ICE agreements, those are in the hundreds of thousands of dollars. Now,
Oh,
granted,
yeah.
we don't have as many sheets of ice as we do soccer and ball fields, but I just want to be sensitive to implementing a more cost into a system that's already feeling pretty vulnerable from lack of participation as it is today.
Well, I support that. That we bring our user groups and have that conversation, because that's what we've always done.
Because that BAC board is a group of volunteers. I don't think they're compensated for their time.
No,
That money doesn't go into anybody's pockets except for maybe the umpires and the officials, which,
Well-
as they should be, but those are
they've
kids.
also had some sticky fingers,
Right. I don't think currently,
but
though,
we don't have the sticky fingers that.
but you see what I'm saying. It's,
Yes, I do.
It's a
Yes, I do.
not-for-profit organization, so.
Yeah. So, are you all right with having our staff bring in our user groups and have a conversation about the fees? And that it's a good thing for us to have
Agreed.
fees, and I
Yeah,
don't
all
think
of them
that they're
should do it.
going to object to it, because they've been doing it, and doing it gladly. Correct, Garrett? Our user groups.
Madam Mayor, the user groups that we're speaking of have not been paying us any type of fee up to this point. So I think the ask would be, if I'm hearing correctly, to bring them to the table and say, we are looking to start to charge some type of fee, then we would like you to start
Yep.
paying that. Are you able and willing to do that? What impact would it have on your organization, participants, et cetera?
Because ultimately that rolls down to
Yeah.
the players
Can
and the families.
you put it back to what that policy is on how we? The fee section? There.
So, off of this particular slide here, city events are free. The second priority is
The youth
identified youth athletic associations based on our youth athletic association policy. So that would include the BAC, the VAA, the LAA, et cetera. And if
They don't pay anything?
they do not pay for the use of
The fields.
our fields. We do have some arrangements with them for what's called enhanced services. So if in addition to just having access to the fields on certain days of the week, they want staff to prepare the fields with chalk and
Yeah.
other things, then we have a fee established to help cover those costs. So, and our Burnsville Athletic Association has been doing that with us for many years, but they could choose to not do that just like the other associations, and not pay anything to us, so.
Well, let's bring them in and let's have a discussion about fees.
Can I ask one follow-up question?
Yes,
So Garrett, on the third priority, those groups are being assessed a fee. What is that fee if you're not part of the longstanding youth associations? Broadly,
yeah.
I understand there's probably,
Councilmember Workman, for the groups that are required to pay a fee, there is an hourly rate. It depends on what the facility is that they're looking to rent, so it can be somewhat complicated.
Sure.
We have, I believe a field is like $18 an hour. If you wanted a complex for a weekend, or multiple fields for a tournament, we do have tournament rates, again, to try to keep those fees down and whatnot.
I got you.
It's 15 to 20 bucks an hour, basically, depending on the facility and whatnot.
So I don't want to throw off the idea completely of, rather than implementing a new fee, just striking those fees. I would rather see us create more accessibility than less. So maybe part of our next conversation could be, what is our annual income from those fees? And is it something this council is willing to part ways with in the name of fairness and equity?
well, let's do the first things first and have the user groups come in and have the discussion.
Okay. I just want to plant that seed now.
Yeah. But if they come and they're all in with, with the fees and understand the cost that's affiliated with all of that,
Right.
then it should be okay. But, so, Danji, bring them in.
Bring 'em in, let's
Kara,
get
bring 'em
people
in.
front of us.
Dan K., you're on board. So, Greg, staff have direction. Let's meet with the user groups and talk about the, fees and their thoughts about all of that. Because once we understand what the issues are, then we can have a good conversation about a policy. Okay? Wonderful. Okay. Is there anything else? Nothing? Then we'll go to roundtable. Okay, roundtable. I believe, Councilmember Keeley, the
Yes.
first item on roundtable is yours. That's Burnsville Center property acquisition.
As a result of a lot of rumors and development activity and redevelopment activity in the mall, it came to my attention that when I look at the examples around the country of malls that have been in significant decline, as ours has, that we as a council should have a discussion about what level of participation and what, if any, participation might look like if a circumstance were to arise where the mall were up for sale again and a prospective buyer was knocking on our door looking for some sort of city participation. The fact remains, as much as it's painful to say, our mall is a C-grade mall, and the option of a Simon or a Brookfield or Pyramid or any other national large-scale mall owner is probably unlikely, who would bring in significant money on their own. Even in those circumstances with those owners, if you look on Google, you'll find lots of examples where cities partnered, did a public-private partnership with that developer, even Simon, in properties in redevelopment types of things. I just don't want to see the Burnsville Center continue to decline any more than it already has. And I've been in that mall every month or every other month for the last few years. And in conversations with the current owner, I advocated very hard for them to clean the carpet because it was absolutely unbelievably filthy dirty and getting dirtier month after month, and it just wasn't getting any attention. It appears in my last visit that that might have happened, but there's stains already being made, new stains on it, but it did finally show some improvement. But we're talking about cleaning the carpet. And when you have to wait, I don't know how long they've owned it, but when you have to wait nearly 2 years just to get the carpet cleaned, and it got to the point where there wasn't a piece of carpet that might have been in a 3-foot square that didn't have a stain on it anywhere that in the mall that you walked, that's a pretty disgusting circumstance. So there's some things going on with the current owner that I'm not 100% confident going into the future that there's going to be significant investment in the mall, what I think the mall needs. It would not shock me if the current owner ends up putting it up for sale. And so if that happens, and you know, we've always been hoping that they would put some money into it, but given their reputation, basically, history does give you a pretty good lens on what to expect in the future in this particular case. They just haven't done it. Now we have, as we all know, we have a new investor group who purchased the Dix and the old Gordmans and some other properties toward County Road 42, and there's some exciting plans that we just dealt with at the council level recently that we're all very excited to see happen. That leaves the rest of the mall, Saratage's property and the core center of the mall. So I think we're getting into this long enough, let's put it this way. I'm a little bit more concerned about what may happen over the long haul. We've watched that mall lose a significant amount of value, 135 million valuation, which provided a substantial amount of property taxes to the city, to today where it's based on a number quite a bit smaller than that. And so our taxpayers have had to make up the difference. That property is not paying what it used to pay. And it doesn't appear that that's going to get any better. And that's what I'm worried about. So I just thought it was time for us to have a conversation about exploring every possibility to provide every tool of financing or some sort of debt service support where the city would get paid back. What I don't advocate and I don't want to imply is that we acquire land. We don't have the money. We all know that anyway. But that if this mall changes hands, or if the current owner comes back to the table and says, I'm going to put 40 million in and I'm going to do all this, but I need a little help, would the city help rebuild this so the city could get paid back in the future in the form of higher property taxes and other, whatever it might be. I wanted the council to have this discussion so we knew as a council, or we make a decision as a council, what is our investment and position going to be in making sure that this mall doesn't go the way of Brookfield or other malls like it, because we continue down that path. It's not getting any better. The property that the new group purchased is going to be great. It's going to look great. It's going to attract a lot of people. It's going to make a big impact on the County Road 42 side of that mall. Mm-hmm. The Saratage side, the Penny side, the Macy side isn't going to change much because Penny's and Macy's will continue to stay open and do business, but what they're attached to isn't getting any better. And that's my concern. It's that core piece that is not being reinvested in, that that potentially threatens the success, long-term success of everything that's attached to it, even these new investors. So I just want to make it clear, I'm not looking for a bailout. This is a public partner, private partnership approach for the city to help where and how it can, but get paid back over time to keep that mall from becoming a Brookdale. I don't know what we can do or can't do, but I think we have to have this discussion.
So we have put tools on the table that we could turn, that when the time comes and they're ready, we would execute a TIF district. And what we want to do, the policy that we all agree to, is that we grow the tax base. What the Windfall Group is doing is internal upgrades that does not grow the tax base. Felix and his group has carved out part of the northern side and put it into outlots so that they can build. So there's supposed to be a Panda Express, and Jeff, I don't know where that's at. We saw a concept plan, but I don't know if they've pulled any permits to begin anything. But that's the only thing that's come out of all of that, that they have done. I have called and talked to the mayor of Edina about what they did with Southdale, and they did not help out. But when Simon came and bought the mall, Simon said, we would like the city of Edina to loan us some money. Now, what Edina had was they had a fund, and that's what we should be doing, is put money into the economic development fund, just like all the other cities, and we've seen all of that. And what Edina used was they loaned Simon $5 million that they paid back with interest fully, and they paid them back. But they had the fund, and they didn't have to go into debt or to bond for it. So one of the things that I don't want to do, and I don't think you want to do, is to put the full faith and credit of the residents and businesses of Burnsville on a debt that we don't know whether they're going to pay back, because I don't trust the Cohan Group and Felix. And I said that when they came to the table, and I had done my research with looking at their website and everything. They come in and they buy. They do some things, but you're right, they haven't done anything. Jeff and I walked the mall. That was, 2 months ago, Jeff? It didn't look any good. It was awful. That north entrance between the Gordman and Macy's and coming in, it was filled with pebbles and sand and everything. So they haven't done. Yeah, the big stains in the front of the Dick's store on the second level, they're still there. Haven't gone away. So I have no trust in any of them.
As I started, this isn't something I'm talking about with the current owners. This is if a buyer comes along, if the mall goes for sale. I'm not talking about doing anything with the Cohen
Yeah.
Group.
The only, I don't see any other tools on the table than the tools that we already have, except to put taxable bonds on, and I won't go down that road, and put the residents and the businesses of Burnsville on the hook for,
That's the balance of the decision that we
Yeah.
face. How far do we let them all go down the tubes? Do
You
we let
know,
it become a Brookdale
sometimes-
before we finally have to
Yeah.
step in and do something, and
you
then it's
know,
just to clean
sometimes
up
the
a
mall
mess?
just has to, because, you know, we've always talked about this, you know, the private sector needs to drive this. And I think, you know, the Windfall Group, Eddie Nee and his group, boy, when they came here and they introduced me to all of their investors, overseas investors and all of those people, you know, they were really, and I'm thinking, okay, if you have the cash
Mhm.
and it's coming from overseas, then
Well,
put it in there, but
Yeah, the example you cited is, let's just do a little comparison. We're a C-grade mall. What do
Yeah.
you think Edina is? Okay, and they still got 5 million help. Simon Group still ended up getting $5 million loan from the city of Edina. That's not a C-grade mall.
Yeah, but what they did is that they had some money, they didn't use their general fund, and they did not bond
I
for
get
it,
it. I
and
know.
they did not put their taxpayers on the hook.
But my point is, you're comparing a higher quality mall in a higher income city who still needed 5 million when they bought it. We have one that is a C-grade mall. We are not Edina in our tax base. Do you not think that we should have a place at the table at all in making sure that this does not become a Brookdale?
Well, you know, I can tell you this, and I don't know where the rest of the council, we have tools on the table right now, but would we be open to somebody if there was a legitimate buyer who knows what they're going to do, and they bring a concept plan before us, and that they tell us when they're going to build it, and they have people who know what they're doing? Okay,
Well,
I don't think Marshall knows what he's doing when he comes in to talk to you guys. I met the people.
Well, whoever it is, we don't know who it is, but I want to understand where this council is going to be when that time comes. If the knock on the door comes, are we as a city going to be prepared to partner with the private sector to save that mall and get our money back in the form of getting paid back and higher property taxes? Or are we just going to leave it completely, a C-grade mall that's been declining for 10-plus years? We're just going to leave that to the private sector? Because if I look back the last 10 years, the private sector hasn't done us any favors. And we and our taxpayers are suffering as a result of it. We were lied to, you and I,
Yeah.
bold-faced lied for 6 straight years from a privately owned mall manager and owner.
Yep.
And so how far down does it have to go before we're going to either step in or just take the risk and the gamble that we're going to clean up a Brookdale one day? Because it's not turning around. And if you do a little search, you'll find examples all over the country where cities partnered with the mall developer to help ensure that it got redeveloped and it turned around and the city got its money back,
And you know,
as opposed to demolishing it where Brookdale went.
Yeah.
When the city just said, we're not going to do anything. And it just continued to spiral downhill. So I hate to use certain harsh words because we don't know what's going to happen in the future. But if history is any lesson, it's not going the way it should. And there is some
Not with the
investment, there's some
people
new
who own it
investment in
now.
it, but
Not-
it's not enough to save the entire core. That's doing a nice job of saving a piece of land, probably a very premium piece of land, facing a very premium road, County Road 42. It's a great piece of land that they bought and that they're investing in. But it's the rest of the mall that I'm concerned about.
yeah, and we've done a great job with the property owners around there to look at a new vision for that area, and we have the Center Village plan in place.
Yes, I
And
would
we
love to see
have
that
tools on
vision happen.
the table. We have
TIF. I
tip
know.
that we can
Yep.
do. We also said that we would work with abatement if that is a tool that is available, when they meet the criteria for abatement. And the county might help us out with an ELF grant, but we don't know that. We
Right.
don't know about the ELF. But
Yep.
the thing is, what I'm saying is that the partnership with some of the things, and I look at the examples of the heart of the city, and we worked with developers, and there were, we had TIF to help with all of that. I just don't, well, I can't put the city in debt to buy taxable bonds to bail out somebody. Well,
The city's already been in debt. The valuation loss and the property tax loss is
Well-
substantial over the last 20 years.
I can take a
We've all
look at
made
that,
up,
but
all
yeah.
the taxpayers have made up every dollar drop in the valuation of the mall. We have all had to make up out of our own pockets.
That is something that happens with regard to economic development and how things evolve
Agreed, but
economically.
the mall is kind of a unique animal. It's a very, very large parcel of land with a massive development on it. It's not just a single business
Yeah.
on 2 acres of land. This is a
How many square
regional
feet?
center.
Jeff, do you know how many square feet the mall, just the mall proper? Because all of the others, the other is all asphalt
Mayor, are you talking the square footage of the building?
of the building.
I don't, we can
Yeah,
get that
because
information,
that's
but I
the
don't.
product.
Yeah, correct.
That has lost value. But the other part is all asphalt. And then, of course, the outlots and all of that,
It's 1.1 million square feet.
yeah. So,
I double checked, but I was pretty certain of that number, and
yeah.
it's in Wikipedia. That's pretty big. I mean, it's kind of an animal all itself. It is a big piece of our economic development
Dakota
of the
County
city.
website says the mall proper is 476,284.
Yeah, that's just the, yeah, you're right, just the
That's the
mall
land,
proper.
right, yeah.
No, but you're bringing in the land, all the asphalt and everything.
That's like that.
Yeah,
No, not JCPenney.
yeah. 4,000? 400?
476, 284.
476? Okay.
I'm
So-
sorry,
There's multiple
That's-
floors in.
Yeah.
the finished square feet is 609,991.
Okay,
Mayor, council, we
Taxable.
Yeah.
can certainly get back to you with
Yeah.
the specific details on that.
but what are you hearing? I mean, I know what this conversation has been between councilmen. We all want them all to have
I would
some
just like
kind
to
of
know
life.
from staff, what tools do we have? Because we have to make the ultimate decision.
Yeah.
You don't, I don't.
No,
We make
no.
the decision, but we don't know what we're working with. We don't even know if we have anything to work with.
Well, I can tell you that we already approved that, and got authorization from the state to create a TIF district there.
Understood.
So
That's in place.
That's there. The other is that we already have authorization to have abatement, correct?
So-
That's news to me.
No,
Madam Mayor, members
it's
of
a
the
tool
council.
that's available to us for economic development. Yeah,
Perhaps the solution is, it's time for a bit of a refresher about
yeah,
what's happening in the Burnsville Center area. And to Councilmember Keeley's question, an opportunity for us to, at least at a very high level, provide a strategic, what I'll call overview of the tools that might be available. I will put the caveat on that conversation gets a bit challenging for several reasons. Right now, of course, staff would eagerly bring the council, should there be a concept plan or property acquisition that's taking place and the developer wishes to speak with you or with staff, we would eagerly bring that concept to you. With the specifics of a project, there would be more clarity, and Jeff can certainly correct me anytime that he wishes, but there would be more clarity on the specifics of the tools. I I would caution the council, should you give us direction to have that conversation, that with forces at play, with there being unknowns about current property ownership or if something's going on the market, I would caution the council around too much opining about those tools, because I don't want to put the city in a position, or I would suggest that we shouldn't put the city in a position where we're artificially impacting certain transactions that may or may not take place. So a little bit of grace from the council. Certainly we could come back with an educational discussion about what some of those tools might be. But at some point in time, we kind of have to call the question about how much guessing we might be playing in those conversations, or what impacts that might be having.
Okay. I'm okay
As
with
a-
bringing,
Potential solution to the discussion.
because we're, we're all remembering different things. I just know what tools we have. So, an education refresher is a good thing. Let's take a look at it, and then we can have more conversations.
I would
But
also
we
look-
we want them all to turn a corner, but we have to find the right people who would want to buy that mall. And right now, I don't know.
I would also look to my team. Our CFO is here, certainly Jeff. I'm making suggestions on the fly here, so looking for potential solutions to help the council navigate the very real and reasonable question that Councilmember Keeley is raising.
Is your team crying yet?
Maybe.
I will just, well, Dan, you go first, because you have your.
Yeah, Dan,
Well, this is the first time hearing this, so I have to kind of get it all in here. A mall that size takes years to lease out,
turn around.
develop. So how long do we end up carrying the debt on this thing, and how much debt is it? I know you said that you don't have anyone you're working with right at the moment, so you're kind of asking us to put a policy together on a plan that really doesn't exist.
Yeah,
And
I'm not,
And I'm not okay with doing that either, and I don't want to put us into debt with that mall out there. 'Cause I'm looking at the Heritage Building, which we already know has some serious issues that could affect the rest of that mall, and once we're on that, we're on the hook as well for, they got millions of dollars in repairs out there. We're gonna be on the hook with that as well, with the regular owners, so it's, I just, right now, there is no risk to our city as far as them leasing out the property. I tell you, I worked with CBL for quite often. They were giving that mall away and couldn't lease it because they weren't putting money into it.
yeah,
This particular group is playing Wall Street. They're just splitting that mall up as much as they can and take as much cash as they can, and they're gonna sell the core and walk
Yeah.
away and smile with the profit in their pocket.
Yeah.
And I'm not there to bail them out. They jumped into this thing, take care of it. That's their job. That's my opinion,
Right.
okay?
Well,
I understand.
just to respond, I never
Hold on,
talked
Dan,
about
let me finish. Let me
Seritage.
finish.
And I'm not talking
Dan,
about
please let me finish.
helping co-eds.
Will you
So-
please let me finish?
Sure, but those 2 points
No,
you
no,
just brought
don't
up
say but and then keep
didn't have
talking.
anything to do with what I
You
presented.
know, just let me finish a conversation. Will you please do that?
Well, then don't respond to things I didn't say. I didn't say anything about
Okay.
acquiring Seritage.
No way will I vote to put tax money into that mall unless it's TIF or abatement or something like that. There's no way I'm gonna vote for a bond, and you need 4 votes for that, just so you understand that.
I'm fully aware
So
of that.
my
but I didn't-
conversation with you just ended again, because you just can't let me speak. You always interrupt.
Because I didn't
That's
say
because I know.
anything about Seritage, or I made a clarification to Madam Mayor. I wasn't talking about the Cohen Group, and that's the 2 points, the first 2 points you came out with. So would you want to stay on point of what I
I'm
said?
done with my conversation with you.
okay. Vince?
I think we all want to see them all prosper, but I, to kind of what's already been said tonight, I'm not gonna make a blanket commitment to something we don't know anything about. If a developer came in with a plan that looked like it would work and gave some reassurances that they were here to see it through, it's all gonna be dependent on what is in front of us, right? So, am I completely opposed? No, but right now, there's nothing in front of us to even consider. And we don't have an EDA fund that
Yeah.
can substantiate any type of loan as it is. And we kind of tussled on that on our last budget discussion. So we'd have to start getting aggressive with our EDA before we can
Yeah.
realistically say yes to any type of funding mechanism,
Yeah.
in my opinion.
Yeah, and I think that's a path. The path is filling the EDA fund
'Cause I don't-
gradually. And the last conversation we had, didn't you say it'll take us 10 years to build that fund?
Madam Mayor, members of the council, the last FMP that you saw was a 10-year plan.
Yeah.
And I would need Jenny to remind me, after that 10-year period of time,
Yep,
If
what
the-
we can do with
if
it.
what was proposed continued to be the council's policy direction,
Yeah.
how much would be available at the end of 10 years? Should we not expend any additional resources? I don't recall. I would have to look.
Okay.
I don't recall what it was at the end of the 10 years. I do think in the budget document at the end of the 5 years with the current plan, it was around.
But to build a war chest,
There was
of
about
the
5
EDA.
million that we had planned to build up by the end of 2027, I recollect.
if
Assuming we don't touch it.
if we levy to the max.
If we levy, we had a stepped increase,
Yeah.
I believe,
Yeah.
over that 5-year period.
Yeah.
I can't remember exactly what those increments are, but there was a stepped increase,
Yeah.
starting with 2023, and then, increasing
Yeah.
over that 5-year period to eventually, I think it was about $5 million. It's around there.
Yeah.
Mayor, council, we will check on that and get back to you.
Yeah.
It was a 5-year plan that I believe at the end of the 5th year, you were maxing out the EDA levy, if memory serves, but we'll remind ourselves and share that with you. It's good. The conversation is good timing. We're back in March with the FMP, so certainly we'll be talking about it then, but ahead of that meeting, we'll get you that information.
Yeah.
And I apologize that I don't remember off the top of my head.
Well, yeah, you can't.
Good thing
can't
you got a
remember
review coming up.
everything. Yeah. Carol, your thoughts
That is
about,
true.
your thoughts about the
What?
conversation?
I was just kidding, Greg.
I don't think it's a bad thing for us to have a refresher on the situation. I also really don't think it's a bad thing for our residents to have a refresher on the situation.
They should know.
Because it's one of the major things that I get questions about, and I'm assuming rest of council gets questions about frequently, are issues dealing with the mall. So yeah, I would look forward to that, and I think that would be a
Okay.
good thing for us, for our residents, yeah.
Okay, so Greg, a refresher, an educational refresher. Okay?
I think I hear 3 of you saying that.
Yeah, I think there's, yeah,
Tools in the toolbox.
yeah.
We will do our, just for clarity's sake, we will do our best absolutely to do that. I think refresher in terms of kind
Yeah.
of the situation,
And-
certainly our plans and how we would respond.
Yeah.
Should opportunity present itself. Just to level set expectations, we will do our best to provide a high level overview of the tools that we currently have available to us.
And I know your plate is full, and we're in budget seasons. So I hope that the council members don't expect that this is going to be turning around very quickly. We don't have anything, to your point, in front of us. So,
Well, I don't know, there was a bar set a few weeks back where they turned something back in 1 week, and it was a pretty heavy lift. Do you remember that? And we said, can we expect
Yeah,
this
we'll
every?
just do that all the time.
yeah.
I'm kidding.
You'll see that
I mean, I'm
updated.
not kidding about, that did happen, but we're not.
You'll see that updated staffing plan too. No, we will do our best to. We got some smart people, and I think that we have a great opportunity here to not only
Yeah.
remind ourselves, but certainly help the community understand
Yeah.
what we may do
Yeah.
when it comes to executing upon the plans that we have. So
Yeah.
give us a little bit of space to do that, and we will be back to you with a work session.
Yeah,
discussion.
because remember, with the mall, it's 196 who gets the 33% of the commercial tax base.
Yeah, that's It is
So,
what it is, right?
and
Doesn't
they're,
matter.
when Greg and I meet with the superintendent of 196, they always want to know what's happening to the mall. Because 196 doesn't have as many commercial properties
Yeah.
like 191 has. So the mall was always something that they're interested in because of the 33% that they receive from that.
Yeah, I'm just interested in the
Yeah.
Burnsville property taxpayer that has
So-
been absorbing all the losses that the mall is
But
suffering.
I think it'll be great for our residents and our businesses to know, because they'll always ask about it.
Well, and I think there's a lot to be excited about right now. I think this new development with the Bolvinos and the Asian market, it could be a match that lights more development. Somebody has to go first. And this
Yep.
could be something that breeds more redevelopment on that mall.
Yeah. My
won't
hope
know
is
till we
that
know,
they move forward, because they've been, at least, so their TIF lawyer, I know very well. So I said, hey, Jay, what are you guys up to? He says, I'm still waiting for direction.
Well, they went through planning and, we approved it. And I mean, that's.
But it
can
didn't
be the most daunting part
Yeah.
is getting those approvals. But yeah, I mean, they could sit on those too. But
Yeah,
I feel like they've spent a lot of money getting those plans set, and they did press conferences and everything else, and so
yeah.
I'm optimistic that might start turning things around.
Well,
Jeff
yeah,
just
I
needs to get
haven't
a
heard
top
from
golf.
Eddie Nee, from the, the chairman of the Windfall Group from Chicago. He, so.
And Mayor and Council, on that specific project, I know we've had some council weekly updates. We're continuing to talk to them about that. We have that scheduled for the April workshop for the ELF grant, ask for that
Yep.
project. That's moving forward. We expect that to come to your April workshop, and they have said, as of this, recently, that they plan to start the construction of that full project yet this year with anticipated completion by the
So
end of
they
this year.
haven't pulled the permits for the internal renovation?
They're just finalizing the plans with their contractors to get the plans in for permit. But they would like
Yeah.
to start here. in
Did they
April.
change architects twice?
Did you see this?
I think they have a couple architects working on the project, different architects for the two different
okay.
phases. One
Two
for the
different
interior.
architects? I know, they're two different firms, right? Yeah.
That's
Okay.
not cheap.
You should send that
Yeah.
to Bill.
I said that's not cheap.
No,
You gotta put that on your
So I don't know, you spend all that money for nothing.
okay, I've seen developers spend a whole lot of money
Yeah.
and spinning their wheels and have nothing, so, okay. All right, so I think staff, you have direction and we're not holding our breath for a quick turnaround. Okay, reports. Kara?
Let him go first.
Yeah, we should let.
Should we ask Bill Coughlin why he's
to
not
go
here
first.
tonight to report in on his, this
On
is
his,
the attachment is a 2017 advisory board external.
Hold on, I
I
can
thought it
be
was
Bill.
really cute.
Michelle? What is it?
You what?
I can be Bill.
Being Bill.
You people,
All right,
oh, that was funny.
Yeah,
He'd always
I
have
could
his
just see
face
like,
in that
oh, that's
iPad.
what I had back in 2017.
okay.
yeah, so, my major one will be the 15th. I have DBB coming up, so we'll, but we have it on the schedule already for an update and all that kind of stuff.
Yeah.
April, I think in April. So,
Every time I
Okay.
watch the council meeting, Bill would be
Okay,
And
so,
Mac, that was really, it's like a time capsule. It was
I
really
know.
cool. It was like, oh, that's what I did back then.
He wasn't
Yeah.
actually in the.
okay, Dan, well, we saw your email, the electric bus fared well in all that snow.
Yeah, it did. It drove really well for a fairly low profile electric electric minibus for our on-demand service. So I talked about that last month.
Yeah.
Which seems like just a week ago or two.
I know.
But it's because
Yeah.
we're a week early on this meeting. But The only thing that's happened since our last work session was the Minnesota Transportation Alliance had their day at the Capitol, and we had some presentations, most of which was general information and knowledge by people who kind of monitor transportation very closely. But I did want to point out that the Senate today at 3 o'clock, the Transportation Committee held a hearing on a bill that Chair Dibble wrote. And it's to promote or to change the Met Council to elected,
Yeah.
all elected, from appointed. And so I found that one very interesting. And obviously, the Met Council deals with transportation and wastewater and other things, organizational, planning.
And
But,
everything, because there
Well,
are
the thing
evil
is-
orders.
and then everything else they can get their hands on,
Yeah.
right?
Well, with Dibble, I mean, you want to shrink government, but he's adding another layer of government.
Well,
I think it's already there.
oh, yeah, that's a.
Just
But it's not going to solve the issue that he
Just-
wants to solve, which is
Right.
the cost
Just making it
of
elected versus-
transit.
Right, we want accountability, and there is no
Yeah,
accountability.
there's
with
no accountability,
appointed
even
people
when you have
if they're
an
working with
elected Met
elected.
Council. You just grow government, and it costs more.
Yes, good point, but elected's better than appointed, but there's some other,
Yeah.
there's good and bad with both.
Are you kidding? You really want an elected Met Council to try and tell us?
Oh, yeah, no,
Municipalities
I've
are their
always-
main constituents.
Yeah, I've always believed that that is an unlawful organization, because it's allocating federal money, and those people are not elected.
Well, that's the only reason why it's illegal. It's because we have the tab. Because most
Yes,
of the people on the
but-
tab are all elected.
Yeah, but we don't want to get into
Yeah,
the
let's not get
technicality
into
of that, but that sort of bought them a little time, but didn't necessarily make it fully legal. Anyway, I don't think I have anything else. I had planning commission back there, back then. I had planning commission.
Okay,
I'm looking
Okay.
at this going, oh.
okay. If you don't have anything,
I
I'll
don't
just
think
move
I have
over
anything else.
to
No,
Vincent
STA hasn't
and
had
Dan.
anything happen since then. I mean, we had a meeting, but there's nothing new. And I-35 is meeting.
No,
Two
tomorrow
days.
we're
Yeah,
now,
in 2 days.
no, tomorrow we are meeting, is it tomorrow? It's not the I-35, it's,
No, that's on Friday, I think. Yeah, oh, you mean the visual,
yeah,
the I-35 Visual Advisory Group?
the bridge.
Yeah.
That's on Thursday.
Is it Thursday? Yeah, it's the
Yeah.
same, then it's the same day
The
as I-35.
I-35 visual quality.
Sorry, I was talking about the Solutions Alliance. That's this Thursday at 7:30, and then the visual quality is at noon
Yeah.
or 1 or something. It was.
Okay,
Thank you.
okay. Vince?
I don't think I have any major festival updates other than things are moving along. Other than that, I have nothing.
Okay.
Did Heather jump?
The only thing I
Danji?
have on Art and All That Jazz is we're doing a Friday night in the Ames Center with Steve Cole, and then all day on Saturday in the park with free music, so,
Yeah, I saw that on Facebook.
yeah. We're
Yeah.
gonna, it's kind of expanding it a bit.
Yeah.
No, I don't think so.
At no cost to the city, by the way.
Although I remember now you telling me about it.
Yeah, I don't have anything to report. Our International Festival Board meeting is tomorrow.
Like, now she's opening her own
The Burnsville Community Foundation is on Thursday,
training for her service animals.
so I have nothing.
Events experience.
Okay.
That's it.
Michelle, anything? Chief? Jenny? Okay. Bethany, you have anything to report? Yeah. Jeff?
No, Mayor?
Okay. You're good?
Nothing for me, Mayor.
Okay, thank you. And with that, we stand adjourned by acclamation. Thank
We
you,
made it within
everybody.
3 hours
Yeah.
with a half-hour dinner break.